Hi, I'm Liz Hillen, prosthetist orthotist with SPS. Welcome to the Clinical Minute. I am joined here by Jak Kesselring, Director of Clinical Education for Thuasne USA. We are here today to discuss the Rebel ligament knee orthosis. Let's go ahead and discuss all the great features and benefits of the Rebel ligament.
Sure, yeah. So the Rebel series has been out for a while. It's one of Thuasne USA's premier knee orthoses. And the Rebel series is a really nice one because it is made out of that lightweight aircraft grade aluminum. And then we have the TM5 on the side, the tibia bolster at the bottom, and the compression suspension strap in there as well. So we can walk through some of those features and point them out on here and give some of that information.
Absolutely. Well, the TM5 joint is the signature knee joint that we all as orthotists love. Why is that? Why do we love this joint so much?
It's a great joint. You know, the history of it was that it was designed to be more anatomically knee-centered. So a lot of the joints previously did not accommodate for the anterior translation of the femur on the tibia. So what Jeff Townsend had designed years ago was for this TM5 to more anatomically represent the knee joint center and accommodate for that anterior translation after flexion and extension.
In comparison to the single axis joint, this slides and glides the way our normal anatomy does. So that's one of the things that I love about this knee joint.
Yeah, and you can see it here too. So when we watch the joint kind of bend and go into that flexion and extension, we see that kind of oval motion there. So it's the pieces inside that are flexing and extending and accommodating for that motion.
And then of course, migration with all knee orthoses is always problematic. Let's talk about that.
Yeah, so one of the big things we do is when you look at the device from the bottom, from the calf, you can see that there's this curved part and then this flattened area here. So what that is a tibia bolster. So when you put a cylinder on a cylinder, everything's just gonna rotate around each other. So what we ended up doing was flattening out part of the calf section to sit on the tibia in order to lock it down and provide kind of more of a bony lock there.
So this is a right, and then the left would have the flattening side on the opposing to mimic the tibial crest anatomy.
Yeah, and you can always tell because the Thuasne logo is going to be on your lateral side.
Tell us about the inside lining here and how the strapping works to help prevent that migration.
On the Rebel series and the Rebel Reliever, you can get the CS package, which is compression suspension. And so that is the anterior strap at the calf and an anterior strap at the thigh, which is not on this just standard model, but is an option you can get. And what that does is it provides that compression and suspension so that you're not getting a lot of migration.
Excellent. And is there a sequence in which the orthotist and the patient will apply the knee orthosis on?
Yeah, definitely. So we do have a strapping sequence, and it's really important to start with that posterior calf strap because that's the first one that's going to lock down the anatomy and kind of hold everything where it needs to be. Then we move into the other straps from there, and you're going to have a technical section on that as well.
Yes, perfect. Excellent. Well, thank you, Jak. If you would like more information about the Thuasne USA Rebel ligament knee orthosis, go to spsco.com. This has been the Clinical Minute. Thank you for watching.